tick-borne encephalitis virus is a growing concern and is as an emerging pathogen. It has been spreading to areas previously unaffected, and there's been a large increase in the number of reported cases. I'm here today with Martine Ruggli from pharmaSuisse, who's been telling delegates here at the FIP Congress how Swiss pharmacists have been contributing to public health in this area. Ms. Ruggli, thank you for being here.
Thank you for inviting me.
Wonderful. Would you mind first reminding us what is this virus and what are the symptoms it causes?
Yeah, that's a virus that is actually in ticks, infect ticks, not all the ticks, fortunately. And this virus is causing many symptoms, only in a certain amount of people. So it's usually you have no symptoms or a flu-like symptoms in the 7 to 14 days after you got bitten by the tick. And 5 to 15% of population can get actually neuropsychiatric symptoms like dizziness, headache, walking disorder, but that can go to paralysis of a leg, of an arm, even of the face, of the nerves of the faces, and 1% of those patients will die because of the disease. Ticks are actually carrying other diseases also, but it's not virus, it's a bacteria. It's well known Lyme borreliosis. And we see ticks usually in forests, and they feed on blood from human and deer.
And so once you start showing neurological symptoms, is it irreversible at that stage?
Yes, because there is no treatment. You can just do symptomatic treatment, but there is no treatment for the symptoms that you have.
I see. And why do you think we're seeing an increase in the spread and rise in reported cases?
Actually, this tick-borne encephalitis is already well known in Russia and Far East, but it's coming towards Europe. And we are following in Switzerland since about 20 years this tick-borne encephalitis disease. And we're noticing that we have an increased number. So we had like 100 cases a year for about 10 years, and now we have almost 400 cases a year. So it's a large increase. I think the causes are multiple because you have climate change, and I think that's an important cause. As we see ticks, we had ticks actually till an altitude of 1,000 meters, and now we have ticks till 2,000 meters. So it's spread all around Switzerland. And also difference in the activities of people. We are more outside. We have more outdoor activities, and where we are outside, we are wearing shorts and t-shirts. So it changed actually the pattern, and you can get bitten by ticks.
Yeah. And we want people to be outside, right?
Yes,
too.
Exactly.
So what are the preventative measures that can be taken?
Okay, you can do things against the ticks himself. So what you do, you cover with long sleeve, you wear trousers, and you put your trousers in the socks. That helps. You can put repellents also. And when you come home, check for ticks. Take a shower and look if you don't bitten by ticks. And if you see something, take it away right away. That's very important. You can use repellents, of course, that helps a lot. But if you want specifically against this disease, then you have to vaccinate.
And so how have pharmacists in Switzerland been contributing to prevention?
Pharmacies were helping in prevention measures, discussing with the patient about all the prevention measures that you can do, but newly they can vaccinate. In 2018, the government decided to recommend the vaccination for all Switzerland, but 2 cantons, and 16 cantons decided to allow the right to the pharmacists to vaccine against TBA. We have only 326 pharmacists in 2018 who shared their data with us. It was 600 pharmacists that were vaccinating. But those 328 did 10,000 vaccinations. So it's a lot. It's improving the coverage. And what's very important, we ask questions to the patient to know what they would have done if they couldn't come to a pharmacy. And 20% of them say they wouldn't have get vaccinated if they couldn't have come to the pharmacy. So it's important help the pharmacist was there giving.
Absolutely. It's exciting to see pharmacists being able to meet that unmet need in that area.
It's important.
That is. And I wanted to ask, have you been able to see yet, since you've seen an increase in vaccinations, have you seen a correlation yet with the number of cases of the virus?
We have a report every month, and now we are around 200 cases. So it's a little bit lower because usually you get the disease at the beginning of the year. But I'm not sure we can say something yet. We have to wait for the numbers for all year. But I think we will see something next year because people are increasingly coming to the pharmacy to get vaccinated.
Yeah. So hopefully we'll see that go down.
Thank you.
Ms. Ruggli, it's been a pleasure. Thank you. This is Whitley Yee reporting for FIP at the World Congress in Abu Dhabi.